Hello, my name is Talisha Woodson.
And I'm Sarah Moore.
We are both monitoring consultants with the Infinite Pilot Connection of Virginia. Today we will be doing a web tutorial on how to complete your initial fiscal form. As you can see on the screen, we have a fiscal form that is requested during at the time of the local contract to be submitted back to the state lead agency. We will be going through this form in depth today, providing visual examples of how to complete this form, along with verbal instructions and clarifications on how to provide details about these individual category areas. We're going to start talking about revenues, and then we will go from there to how to complete information in direct service, and we will close with how to complete your systems operation details. At the top of your form, it is important that you complete your infant toddler connection name. There's a box there. Here we call ourselves Rapid River, and it is important that you complete this information once you open your initial budget form. You also should add your DUNS number. This number is unique to each individual local system. If you do not know your DUNS number, please contact your local fiscal office and they should be able to give you this information. So let's start talking about Section B of the fiscal form, which is revenue sources. In the annual budget, you are to record dollar amounts that are budgeted for Part C for this particular fiscal year from each of the specific revenue sources listed. Prior year retained earnings are to be included in this column. Local systems may choose to reflect only the revenue dollars budgeted by the local lead agency or may reflect expected revenue for the system as a whole. So here are the sources. First, we'll talk about the federal Part C funds. The federal Part C funds is the amount of the federal Part C funds allocated to the local system for that particular contract year. This amount should match the amount of the federal funds specified in your local Part C contract. Federal Part C return earnings refer to any unexpended federal Part C funds from the prior fiscal year. State Part C funds refer to the amount of state Part C funds allocated to the local system for that particular fiscal year. This amount should match the amount of state funds specified in your local contract. Per state budget language, state Part C funds may only be used for the provision of direct services. State Part C return earnings refer to any unexpended state Part C funds from the prior fiscal year, and again must only be used for direct services. State funds refer to funds other than Part C funds that were originally state revenue awarded by the Department of Behavioral Health and Developmental Services to the Community Services Board or other state revenue awarded to a non-CSB local lead agency or another participating public agency. For example, if the ID program at the CSB received funding that was shared with the Part C fund program, the funds provided to the program would be listed here. Local funds refer to any funds that were awarded to the local lead agency to be used for Part C. These funds were originally local government revenue. These funds are typically awarded to the program via the local lead agency. Medicaid refers to revenue for Medicaid for the provision of early intervention services through the Medicaid Early Intervention Program. This is any Medicaid revenue received for early intervention services provided such as speech, occupational therapy, physical therapy, vision, developmental services, and other EI services. Medicaid EITCM revenue refers to Medicaid revenue received for the provision of early intervention targeted case management services. Insurance refers to revenue that is a reimbursement received from commercial insurers. TRICARE refers to reimbursement from TRICARE. Family cost share refers to revenue from the collection of family fees for the provision of Part C entitled services. Donations refer to individual or organization contributions to the local lead agency. In kind is a reasonable value of the cost or actual cost of positions, supports, and or other services that is provided to the program at no cost or charge to the Part C system. Other refers to any revenue source not specifically listed on this section. So anything that doesn't fit into any of these other previous categories would be here. As you can see, we have some amounts that we have put into the annual budget category for each of these, which we have chosen to use today for the sake of conversation to kind of help everyone understand how the budget should be completed. So as you can see, depending on what amounts you receive or unexpended amounts that you have for each of these categories, that you would plug in first. So you want to first document anything that any funds that you know that you're going to have or receive. That should be documented here. Of course, early intervention, TCM, as well as Medicaid revenue and things of that nature should be projected cost based on what your system has done in prior years or what your system has received in prior years. We'll get into a little bit more detail about how to specify information specifically under in-kind as well as other as we move forward. Now we're going to go to Section A of the budget form. And here we're going to talk about these three columns here: annual federal Part C revenues, annual state Part C revenues, and additional revenues. So what does all that mean? Annual federal Part C revenues refer to the amount of Part C funds allocated to the local system for that particular fiscal year. As we stated before, those amounts should be reflected in what you received through your local Part C contract. So any amounts that are expended in this category at the bottom of that category should be a subtotal operations cost. Total revenue expenditures column. That column here, that total, should match what your federal Part C revenue is for that particular fiscal year and retained earnings combined. So if you have federal retained earnings, you would add that amount to your federal allocation, and that total together should equal to the total in this particular column. The same is true for your state as well as your additional revenue. Remembering that additional revenue refers to any revenue that your local lead agency receives outside of federal Part C dollars and state Part C dollars. Your annual state Part C revenues here, again, refers to allocated amounts for from the state for Part C funds for that particular fiscal year, and again should match the amount specified in your local contract. And additionally, the additional revenues, which I've mentioned, also would include all revenues actual and anticipated that would supplement the state and federal Part C dollars. The total revenue column here is going to be the amount to include the total of all state, federal, and additional revenues. This figure is calculated by the spreadsheet, and the total must match the total in the annual budget column in Section B. No data entry is required into this section as the spreadsheet is set up to automatically calculate these totals. So as you can see, we have a listing of amounts that are included under annual federal Part C revenues. And we have allocated these amounts based on projections that, of course, you would enter your local numbers here that would calculate how much is being allocated for each of these services out of federal funds. Again, your federal total revenues and expenditures should match what your federal allocation as well as unexpended funds equals. Same is true for state Part C funds and additional revenues. And then your total revenues is added by row across the board. As you can see here for our assessment for service planning, that $35,383 is what the federal, state, and additional revenues together, what that total revenue is that is allocated for assessment for service planning. So you would pretty much follow this same format for each item that is listed under direct service. And the same is going to be true when we start talking about systems operations. Now, it's important for us to mention here that we're going to go back down to Section B because I want to point out two things. In a second, Sarah's going to talk a little bit more about in-kind, and she's going to go into more detail about what this is that's listed here referencing the salary and why it's important to put that here. But also wanted to point out that if your system is experiencing an anticipated deficit, this is where in this other category where that would be noted on your budget. This does not replace the system's responsibility to notify the Part C Administrator, Catherine Hancock, as well as copying their TA monitoring consultants about the system's need for additional funds to operate the local system. Documenting here your anticipated deficit helps for us to get a clearer picture of the state of your system. However, we cannot operate off an unbalanced budget, so here we put the number of the deficit so that the budget was balanced, and for those of you in the field that know, so that that blue box goes away. Now we're going to turn this over to Sarah, and Sarah's going to talk about systems operation details.
The systems operation portion of your budget is where you capture the cost of running your system that are not attached to direct services. As you see, the black box is here under state funds for system operations. This is because, as Talisha mentioned, state funds can only be used, state Part C funds can only be used for direct service. So your costs of system operations will come completely from your federal Part C revenues and your additional revenues. And systems operations are broken down into 6 categories. Your first category is administration. Administration covers the operational cost to the local lead agency to administer this contract. You can take 5% of your total allocation and put it towards systems operations administration. However, that 5% has to come entirely from your federal funds. So 5% of your total allocation of Part C, state and federal funds can be allocated to administration, but that full 5% must be expended from your federal Part C revenue. The next category is system management. These are the costs associated with the local Part C system manager and support staff and would include salaries, benefits, office space, mileage costs, equipment, and supplies. Costs associated with billing, service authorization, collection of revenue, and system oversight would also be included in this category. Your next category is data collection. And these are the costs associated for access and maintenance of all the resources you need to complete the written activities for compliance with your local contract and management of data required under Virginia's Part C General Supervision and Monitoring System. So these are the costs associated with your ITOTS data entry and being able to fax your required forms to the state Part C office. It is important to remember that computers for the use of direct service staff come out of your direct service budget for those categories. This data collection category is only for system operations and would include the cost of computers and resources for ITOTS data entry and sending information to the state. Your next category is training, and these are the costs associated with the training of personnel providing services to the infants and toddlers served by your system. Next, we move to public awareness and child find. And these are the costs associated with identifying all potentially eligible children within your locality. And finally, we come to other system costs. This includes other costs that are not delineated above. An example of another cost that would go in this category would be a cost associated with interpretation and translation. The amount you put in systems operations, other system costs, must be itemized under your systems op detail. In just a minute, we're going to move to the systems op detail tab. The purpose of the systems op detail tab is to explain all of your expenditures in these 6 categories. You should be able to read what's written under systems op detail and know exactly where the funds allocated in these 6 categories are going to be spent. So let's move now to systems op detail. Systems op detail is where we capture the cost associated with providing services to children in your system. Every system will have their own unique systems operation costs. And that is why it's important that you capture where these funds go on this systems op detail. If you look at our example here, you see under administration, they have included their in-kind of $22,000. And then they have broken that down to tell you what it's including: electricity for their office space, rent, and cleaning and maintenance of agency vehicles. And the individual cost of each of those expenditures is also broken down. As you can see, this level of detail tells us immediately what is given in kind related to system operations and what those associated costs actually break down to. Underneath this, you see their administrative costs, where we've calculated $10,656, which is 5% of the total allocation. In addition to saying what you were awarding to administrative costs, we also need to know what you're going to do with it. And here it states that these funds are used to cover the HR cost for the infant program. Then under administration, we have remaining funds of $15,831. And this covers IT support, electronic health records, and billing and reimbursement staff. Remember, the administration tab is the operational cost to the local lead agency to administer this contract. So in this detail, we see that cost to the local lead agency for the electricity, for the rent, for the agency vehicles, for human resources, and for IT support, electronic health records, and billing and reimbursement staff. Now we'll move to system management. And again, system management refers to costs associated with the local Part C system manager and support staff. In our example here, the local system manager is allotted 50% to the Part C program. So we see here that $28,000 is 50% of the salary and benefit. And then we also see that an additional $24,656 salary of direct clerical staff. So in this category, you want to capture your salary and benefits for the local system managers, and also salary and any associated benefits for support staff. If you had a system manager who also provided service coordination, then you would want to take the percent of time the system manager allotted to service coordination, and then you would take that percentage out of the salary and put it back under direct expenses for system management. So under system management here, you want to capture the percentage of the local system manager's salary and benefits that goes directly to being the LSM. For data collection, once again, this is the cost of collecting the data and sharing the data with the Part C office as required in your contract. So here we have the cost of the computer use for the clerical staff is $1,000 and copy and fax machine rental for $549. In training, we have what trainings the system anticipates staff may attend this year and the projected cost. Here they've chosen to send 2 staff to Kaleidoscope training and also to send providers for support on coaching facilitation. And they have their projections that are based on last year's cost for Kaleidoscope. And again, public awareness and child find are the costs associated with identifying all potentially eligible children within your locality. And here we see the costs that are broken down to the cost of printing, public awareness brochures and materials, how much it is per poster or brochure, and what is the total cost. We also see in this system detail that this system is targeting the medical community because they have seen a decline in referrals for the medical community in the last 2 years. So under public and awareness and child find, what we would like to see is what are your costs associated with the materials related to distributing information about your program, and also who are you targeting with your child find activities. And finally, we come to other system costs. And as I mentioned before, other system costs reflect costs that are not covered in the other 5 systems operation categories. And here we have reflected the cost of translation. And as you see, this is broken down again into the estimated number of IFSPs that we will need translated and the cost, the estimated amount of interpretation the system will need and the cost, and the estimated time of sign language interpretation the system will need, and broken down by cost. The more detail you provide under systems operations, the clearer the picture you paint of the cost of providing services under your local lead agency. Once again, as we mentioned before, we need to be able to look at the system operations allocations on your budget and then come over to these categories and have an understanding and a picture of where those funds are going and what costs they're covering. And again, be sure to include anything that is given to you in kind by the local lead agency. Include it as a revenue and then include the cost in the categories where they belong so that your budget is a true picture of your locality.
Speaking of in-kind, Sarah, I wanted to go back to revenue by source and just make mention of this part-time developmental services salary position that is noted here. Because systems op details specifically refers to amounts that refer to operation of the system, that is captured on this detail. However, it is possible for your local system to provide services and or positions in kind to your program. If that is the case, this is where that information will be captured. As you can see from our example, we have documented here that a part-time developmental services salary of $10,000 is provided in kind to the Part C program for this specific local system. If you have questions about how to complete your fiscal form or your budget, please contact your technical assistance or monitoring consultant team for additional assistance. We hope that this has been helpful today, and happy budgeting.
And thank you for your time.